Hi everyone. Today we are going to see about another obstetrical emergency, that is shock. Shock means it is inadequate perfusion leading to inadequate oxygen delivery to tissues. That is, due to decreased blood supply, oxygenation to the tissues will decrease, and that condition is known as the shock. Now let us see the types of shock. The types includes hypovolemic shock, cardiogenic shock, neurogenic and anaphylactic shock, septic shock. In obstetrics, you can see commonly the hemorrhagic and septic shocks. Other shocks are also there, but the common causes of shock in obstetrics is due to the hemorrhage and sepsis. So let us see about the hypovolemic shock first. Now we are going to see about the causes of hypovolemic shock in obstetrics and gynecology. We are going to see the causes of the hemorrhagic shock. First one is antepartum hemorrhage and postpartum hemorrhage. That is, bleeding that is occurring during pregnancy is known as antepartum hemorrhage, and if it is occurring after delivery, it is known as postpartum hemorrhage. And this hemorrhage may leads to the or this severe bleeding may produce the shock. Another reason, fluid loss. Fluid loss may occur due to the hyperemesis gravidarum or maybe due to diarrhea. That is, excessive vomiting during pregnancy is known as hyperemesis gravidarum, and diarrhea. These two conditions may produce dehydration. Dehydration may produce ketoacidosis, and that may lead to the shock. And another reason is, in the case of severe burns, there is a chance of plasma loss, and that may lead to the shock. And next one is supine hypotension syndrome. Supine hypotension syndrome means there will be sudden drop in blood pressure when the patient is changing or when the person is changing the position. For example, if the woman is changing her position from sitting position to standing position, or from lying down position to standing position, or to the upright position, due to that position change, sudden drop will occur in the blood pressure, and that may produce a shock. And next is splanchnic shock. When the intrauterine pressure is decreasing suddenly, for example, in the case of polyhydramnios, if you are performing the artificial rupture of the membrane and if you are allowing the fluid to escape suddenly, that may lead to the decrease in intrauterine pressure suddenly, and that may produce the splanchnic shock. The most common form of hypovolemic shock in obstetrics is hemorrhagic shock due to massive obstetrical hemorrhage, that is due to the bleeding antepartum and postpartum hemorrhage. Next, let us see about the obstetrical hemorrhage. Blood loss associated with pregnancy or parturition that causes maternal or perinatal death. It requires blood transfusion, and hematocrit level will become less than 10 points, and that condition produce severe emergency support. This can be categorized according to the severity. It can be classified into class 1, class 2, class 3 and class 4. In the case of class 1, blood loss will be up to 15%, and in phase 2 or in class 2 it is 15 to 30%, and class 3 it is 30 to 40%, and in class 4 it is more than 40%. And the pulse rate will be less than 100 in class 1, it will be more than 100 in class 2, more than 120 in class 3, more than 140 in class 4. And blood pressure, pulse pressure and blood pressure, in the case of class 1, the pulse pressure will be normal, and blood pressure also may be normal. Sometimes it may increase, and in all the other cases, that is in class 2, 3 and 4, the blood pressure and pulse pressure will decrease. So this is a categorization of the hemorrhagic shock on the basis of symptoms. And according to the degree of effect, it can be classified into the shock can be classified into 3 stages: uncompensated shock, compensated shock and irreversible shock. So now let us see what is this uncompensated, compensated and irreversible. Compensated shock means the defense mechanisms in the body are successful for maintaining the perfusion. Already we have seen that decreased perfusion, and that leads to decreased oxygenation. That is a shock. But here in the case of compensated shock, the body will take alternative measures or compensatory mechanisms, and those compensatory mechanisms will be sufficient for managing the condition. That is, the patient will be having tachycardia, decreased skin perfusion will be there, altered mental status will be there, but body by itself will initiate the compensatory mechanism. By that way, the shock may get managed. Next is uncompensated shock. Here, the defense mechanisms of the body will fail. The body, whenever the body is trying to go back, or whenever body is trying to recover, that compensatory mechanism will fail, and that is uncompensated shock. And it is manifested by severe hypotension, severe increase in the heart rate, rapid thready pulse, agitation, restlessness, and confusion. These will be there for the patient. Next is irreversible shock. In irreversible shock, complete failure of compensatory mechanisms will be there, and the body may not be in a stage to go back. So tissue perfusion will be very less, and that will produce the damage of the tissue, that is even death of the tissues. And even if you are resuscitating also, if you are taking the other measures, if you are giving blood transfusion, if you are giving the resuscitation, if you are giving oxygenation also, sometimes you may not be able to save the tissues. That is the irreversible shock, or save the cells. Next, we can see the signs and symptoms of shock. Hypotension, that is decreased blood pressure, rapid and weak pulse, pallor, the patient will be pale, sweating will be there, extremities will become cold and clammy. This cold and clammy extremities you can see commonly in the case of hemorrhagic shock. Oliguria and anuria, and high confusion. Oliguria means decreased urinary output, anuria means absence of urine, and the patient will be in a stage of confusion. And now we can see the initial management of shock. First, we have to start an airway, maintain airway, and we should give high concentration of oxygen, may take measures for the ventilation, and place the patient in Trendelenburg position so that the maximum venous drainage will be there from the extremities, and by that way you can manage the hypotension or decreased blood volume. And if severe bleeding is there, means control the obvious bleeding and keep the body warm, prevent the loss of heat from the body. And for restoring the circulatory volume, start IV catheters, give crystalloids and colloids for the patient, give 5% dextrose in ringer activated solution till the blood products are getting, and once if the blood products are available, start the colloids and pack the RBCs to replace the blood loss. Order minimum 6 units of red cells and apply compression cuff to infusion pack. Monitor the central venous pressure and arterial pressure. These are the measures you can take, especially in the case of hypovolemic shock or in the case of hemorrhagic shock. And the complications of hypovolemic shock include renal failure, that is decreased perfusion to the kidney leads to the failure of the kidneys, and pituitary necrosis. Decreased perfusion may leads to the necrosis of the pituitary gland, and that produces Sheehan syndrome. That is, damage of the pituitary gland will occur, and finally pituitary hormone production will not be there for the lady, and that syndrome is known as the Sheehan syndrome. And another one is disseminated intravascular coagulation, that is widespread coagulation in the body. Next, we can see about the neurogenic shock. Abnormal vessel tone due to trauma and tissue damage, and is as in painful conditions, that is without any external reason as like bleeding or as like sepsis. All of a sudden the person will go to a stage of shock. You can see it in the case of severe pain or in the case of severe other form of irritations. The obstetric causes of neurogenic shock we are going to see. Disturbed ectopic pregnancy. Ectopic pregnancy means we know it is pregnancy other than the uterine cavity, that is implantation of the fetus outside the uterine cavity. That is known as ectopic pregnancy. It may be in the fallopian tube, or it may be in the cornua of the uterus, or it may be even an abdominal pregnancy, or it may be an ovarian pregnancy. In all those cases, there is a chance for irritation of these structures, and that may lead to the shock. And concealed accidental hemorrhage. If internal hemorrhage is there for the lady, and if it is not visible, that also may produce a shock. Manual removal of the placenta without anesthesia. See, if the obstetrician, or if the gynecologist, or even if the nurse, if they are removing the placenta manually without giving proper analgesics to the patient, or without giving anesthesia, there is a chance for shock due to the severe pain. Difficult forceps or breech extraction. In the case of difficult breech or forceps extraction, what will happen means the patient will be tolerating the pain for a long period, and that may produce a shock. And rapid evacuation of the uterus in the case of polyhydramnios. Already I have told you about this. In the case of polyhydramnios, when you are performing the artificial rupture of the membrane, or in one or another way, if you are just emptying the contents of the uterus, I mean, if you are emptying the amniotic fluid, what will happen means sudden drop will occur in the intrauterine pressure, and that may produce a shock. And now let us see the difference between neurogenic shock and hemorrhagic shock. In the case of neurogenic shock, the patient will be quiet and apathetic. And in the case of hemorrhagic shock, the patient will be irritable, anxious, and the patient will be struggling for the oxygen. And neurogenic shock, you won't be able to see the hemorrhage. Hemorrhage won't be there. But in hemorrhagic shock, external or internal hemorrhage will be there. And if you are checking the superficial veins in neurogenic shock, it will be full. But in the case of hemorrhagic shock, peripheral collapse will be there. And in neurogenic shock, hemoconcentration will be there. In hemorrhagic shock, hemodilution will be there. These are the differences between neurogenic shock and hemorrhagic shock. Next is septic shock. It is occurring due to the severe infection. That is, if bacteria is there, bacteriemia is there, and if it is producing severe shock, that is known as the septic shock. In this case, the blood vessels will dilate, and sometimes it may even starts to leak. Now we are going to see about the causes of septic shock in obstetrics. One is septic abortion. If someone is performing illegal abortion, sometimes even if it is illegal abortion also, if it is producing infection, if you are not practicing sterile techniques, there is a chance for infection, and that infection may produce the septic shock. Another one is pyelonephritis, infection of the kidneys. Chorioamnionitis, because of one or another reason, if there is if infection of the amnion and chorion, that is fetal membranes, are occurring, that may produce a shock. And retained placental tissue after the delivery of the baby. During the placental separation, if the placenta is not getting separated fully, and if bits of placenta is remaining inside the uterus, that may produce severe infection. And the reason is puerperal sepsis, that is infection in the postnatal period. It may be due to the prolonged labor, or it may be due to the repeated intrauterine examination, that is repeated purvaginal examination during pregnancy or during the time of delivery. It may due to the decreased immune power of the lady due to one or another reason. Sometimes even urinary tract infection also may produce the sepsis. And post-operative infection, that is infection of the cesarean wound. Or otherwise, after doing the manipulative deliveries, sometimes there is a chance for infection of that wound, and those things may produce a septic shock. And how will you identify the septic shock means? In the case of septic shock, in the earlier or in the beginning, patient will be warm, and if you are checking the extremities and if you are observing the symptoms, it will look as like neurogenic shock. But later, the symptoms will start to resemble or mimic as like hypovolemic shock. That is, the cold extremities will be there, and finally it will be as like the symptoms of hypovolemic or hemorrhagic shock or cardiogenic shock. Next is cardiogenic shock. If there is a failure in the heart, that is, if there is a failure for the heart to pump the blood effectively, that will produce the cardiogenic shock. Now we are going to see about the Causes of cardiogenic shock. It includes coronary spasm, cardiomyopathy, pulmonary embolism, amniotic fluid embolism, Mendelssohn syndrome. Mendelssohn syndrome means it is the aspiration of the gastric contents, hydrochloric acid, especially the acid contents, into the respiratory tract. Then symptoms of cardiogenic shock include tachycardia, tachypnea, respiratory distress, mental status change, cool extremities, poor perfusion, and the signs of dehydration also will be there. So that's all about the obstetrical shock. The nursing diagnosis can be added along with this. Thank you for watching this video. Thank you.